Everybody can smile pretty. Okay. It's warm in here. Okay. Hello, my name is Nancy Ingle. I have been an LPN for 16 years, and I've been an LPN on 5 East, our medical oncology floor, for 12 years now. I'm going to talk to you about today is your role as a new RN in a blood transfusion. My information is coming from Reed's Policy and Procedure manual that we have, and I want to inform you how to check and hang blood. Packed RBCs is the most common blood transfusion you'll do, packed red blood cells. There's a lot of other blood products. In the policy and procedure here, there's about 17 pages of blood products and how each one of them are different, but packed red blood cells is the most common. The first thing you're going to get is the order from your doctor to check or to give blood. Type and cross match is usually the way it'll read. 2 units packed RBCs. You want to make sure you have an order, make sure the clerk has entered it correctly, and then you want to the next step is going to be to make sure lab has come up and drawn your blood. When they come up and draw your blood, you're going to see a red armband put on the patient that's got a 4-digit number on it. That number is placed on the armband, also placed on the blood that goes down to lab to verify that the blood drawn from that patient is the blood that's going to check for the transfusion. The next step would be to verify that the patient's hemoglobin is appropriate for a blood transfusion. Most of the time it's below 8 or 9. Every doctor's different, every patient's different. Or if the patient is symptomatic with shortness of breath, severe fatigue, or if there's any active bleeding. Those are the most common reasons for giving a blood transfusion. The next step would be to verify that you have a give order. Some doctors will write type and cross match and give the blood, or they can put it on hold for possible future use for surgery, so you want to make sure you have a give order. We've talked about the red armband. Make sure your patient does have on the armband. After that, after approximately an hour, you're going to get your paperwork up from lab that's going to show your blood type, which is your A, AB, B, or O. Your next step in paperwork is going to be your RH factor, which is going to be negative or positive. If you get a negative, you're good to go. You're ready to issue your blood. If you get a positive, that means the patient has antibodies in their blood, and they have to do a match for that, and that's a whole other set of problems that you'll get into. Your next step would be to get a consent. Patient does have to sign consent to get a blood transfusion. If they do refuse, I've got a consent over here. If they do refuse, there's a paper to sign for that also if they're refusing a blood transfusion. After that, you're going to verify that they have a 20 gauge needle in, which is a pink needle, and that makes sure that the IV is large enough to receive the red blood cells without them being damaged. There are a few instances in when you can give a red blood cell or a transfusion with a smaller gauge needle, but you have to have orders, and there's a lot of other particulars to that. Blood transfusions can also be given through a port, a PIC, or a central line. That's considered a 20 gauge or larger. Next, you're going to check the patient's vital signs to make sure they're within normal limits, and that's normal for that patient. A lot of times if your blood pressure is low, that's going to be normal because they're low on blood. The biggest thing is their temperature. If their temperature is greater than 100, is kind of a unwritten rule, then you should call your doctor and have an order to give that blood and wait till that temperature returns to normal before you start it, unless it's an emergency condition and you need that blood in now. But you still would need a doctor's order. Next, you're going to look at pre-meds. If the doctor's ordered pre-meds, pre-meds are normally Tylenol and Benadryl that are given, and that's to help prevent a transfusion reaction. There's always that chance of that, and given that Tylenol and Benadryl 15 to 30 minutes before your transfusion would help prevent a reaction. The next thing you would verify is that the patient has normal saline at keep open. If they have normal saline at 100, you would still use that bag. Only 0.9 normal saline can be given with a blood transfusion. It has to be dropped to a rate of keep open due to issues of fluid overload, and blood has a thicker viscosity and can put your patients into fluid overload a lot easier. When you've got all that verified and in place, you're going to issue the blood, which just tells the blood bank that you're ready for that blood to come up to you. The biggest thing is once you issue that blood and you receive that blood, you now have 4 hours to give that blood. No more time, not from the time you start it, but from the time it leaves the blood bank, which is leaving the refrigerator. Next, 2 nurses must go in and verify that the blood is correct. It can be 2 RNs, an RN and LPN. It can even be a student LPN or RN, as long as their instructor is present. That second nurse, if I'm the nurse giving, that second nurse must also verify the consent, the pre-meds, the vital signs, the saline is hanging at keep open. Because when you put your name on that dotted line, you're saying that you verified everything is correct. You're going to verify all that's in place, and then you're going to physically take the blood, walk into the patient room, both nurses at the same time, to check the blood against the patient's armband. If one nurse says, oh, I checked it, it's fine, it's not good enough. Both nurses physically at the same time must do it. Because if you walked into room 19 and your co-worker walked into room 20, you guys may not have checked the right blood, right patient. So once you both have physically checked the armband, it's all typed into the computer, and it will verify that everything has been entered. Both of you look at the blood, read the numbers. Next, you're going to spike the blood. I have a what a typical blood bag would look like and a tubing. It's a special tubing that's done, and this just spikes into here, and then this goes into your pump, and then you would back prime this up. So this is what it would look like. The RN must remain with the patient for the first 15 minutes of a transfusion, at least within eyesight. Because if you're going to have a transfusion reaction, that's the most common time, and that RN must remain within eyesight. They check the blood vital signs again at the end of that 15 minutes, and then every hour after that from the time of onset. The biggest thing you need to know is if that temperature goes up 2 degrees or if there's new sudden onset of any symptoms. That's a big red flag. You need to stop your blood, monitor your patient, either call your doctor or get another nurse in there to help you work through this. Those are the two biggest things: 2 degrees, new sudden onset. Drawing a blank. Just wanted to just go back over and verify that you know what your role is as the RN, that you're going to stay with that blood and LPN can't check it, and stay with that patient. That you verify your order, you know that everything is correct, your vital signs, your saline, that you know what your role is as the RN in hanging the blood. And I think that's it. Thank you.